To open a drug rehab center in Illinois, your SUPR license application must be in at least 90 days before your planned opening date. Miss that window, and you don't open. The state requires the licensing application at least 90 days ahead of opening, the single deadline most first-time operators underestimate. How to open a drug rehab center in Illinois in 2025: licensing, funding, staffing, and compliance for operators building a real business. We walk through SUPR licensing, startup costs, accreditation, staffing, and the compliance laws that govern an Illinois facility. A drug rehab center provides medical and therapeutic treatment for substance use disorders, detox, inpatient, outpatient, counseling, and aftercare. These facilities offer a continuum of services, from detoxification through outpatient counseling and aftercare programs. In Illinois, licensing runs through the Department of Human Services, Division of Substance Use Prevention and Recovery, SUPR. According to the Illinois Department of Public Health, over 2 million people in Illinois need substance use disorder treatment, but do not receive it due to lack of access. The Illinois Department of Public Health reports opioid overdoses rose 33% between 2019 and 2021, a crisis that keeps widening. In 2023, Illinois saw over 2,000 opioid-related overdose deaths, according to the CDC. The demand for capacity is not slowing. A purpose-built electronic health record system helps clinicians document assessments, treatment plans, and progress notes throughout each stage of care. Behave Health's platform is designed to support documentation across detox, inpatient, and outpatient care, so the clinical record follows the patient. Facilities need reliable revenue cycle management tools to handle claims and reimbursements efficiently, designed into the same system. 6 steps take an Illinois drug rehab from idea to open doors, and getting the order right protects your timeline and your budget. Market research, business plan, location, licensing, staffing, and funding. Let us walk through all 6. Step 1. Research local demand, competitors, and patient demographics. A feasibility study tells you whether a facility in your chosen location is viable before you commit capital. Illinois has significant demand for treatment driven by high rates of opioid addiction and other substance use disorders. Step 2. Build the business plan that secures funding and guides operations. Include an executive summary, market analysis, organizational structure, financial projections, and a marketing strategy. A well-developed plan is what attracts investors or secures loans from financial institutions. Step 3. Pick a location that clears local zoning and serves patients. Illinois zoning requirements for healthcare facilities vary by municipality. Confirm compliance before you lease or build. Weigh proximity to hospitals or clinics and accessibility for the patients you intend to serve. Step 4. Obtain licensing from SUPR within the Department of Human Services. Submit the application at least 90 days before your planned opening date. This is the deadline that derails timelines. Provide required documents including floor plans, fire safety certificates, and proof of insurance. Step 5. Staff the center with credentialed professionals. Hire licensed medical professionals such as addiction medicine physicians, certified counselors, and administrative staff. Your staff need ongoing training to stay compliant with state regulations and best practices. Step 6. Line up the capital. Opening a center takes significant upfront investment. Funding sources include private investors, bank loans, and federal grants such as SAMHSA funding for qualified facilities. Estimates put startup costs at roughly $200,000 to $1 million depending on facility size, per Orion Treatment Consulting. 3 bodies of law govern an Illinois rehab, and accreditation is what unlocks insurance contracts. HIPAA regulates how patient medical information is shared and protected. 42 CFR Part 2 adds protections specifically for patients receiving substance use disorder treatment. If you plan to accept Medicare or Medicaid patients, will also need accreditation from CARF or JCAHO. Behave Health updates its software for the trends shaping Illinois: telehealth growth, tighter oversight, and behavioral health integration. The platform is designed to support assessments, treatment plans, and progress notes across detox, inpatient, and outpatient care. Revenue cycle management tools are designed to help handle claims and reimbursements as your census grows. The software is tailored specifically for addiction treatment centers and updated as regulations evolve. Stop guessing at SUPR licensing and billing setup. Book a 20-minute demo at behavehealth.com. See documentation and revenue cycle tools built for addiction treatment centers at behavehealth.com.